Sean Yates from Ormo Physio. We have had a rush of mistreated and misdiagnosed ankle injuries over the last month. Today I want to give you some free information to help educate the community to correctly diagnose ankle injuries straight away. Term consequences to a person, or even worse, consequences to the growth of a child. Not only can a mistreated or misdiagnosed ankle injury lead to delayed recovery and extended healing time, but may impact long-term outcomes for you or your child. This can lead to further injury or re-injury, severely damage your child's growth, or even hinder an athlete's chance of excelling in their sport. In the last month, 20 people have come to see us because their ankle injuries weren't fully healed. Of those 20 injuries, some of these misdiagnoses happen to kids, and as a father myself, I'm concerned about these kids not getting the proper treatment and then dealing with ongoing limitations or weaknesses for the rest of their lives. This is why I want in this video to educate you on the assessment that you can use, then take to your treating medical professional, whether it be a doctor, a physio, a chiro, an osteopath, to ensure that you get the right diagnosis straight away. Of the 20 patients who came in with an ankle sprain, they actually had either a fracture of a bone in their ankle or foot, a complete rupture of their ankle ligaments, a rupture and a syndesmosis or high ankle sprain injury, or a combination of the above. All of the above injuries at least require more scans than just an X-ray, usually an MRI, but may need a CT or an ultrasound. They all required immobilizations in a boot and intense physiotherapy, and some also required a referral to an ankle specialist, and others required immediate surgery, depending on the grade of their injury. If they had received a correct diagnosis immediately, they would be well on their way to getting back to 100% and not starting from scratch multiple weeks down the track. When should you get a scan? The assessment I want to teach you today is called the Ottawa Ankle Rules, and they are about 90 to 98.5% accurate in diagnosing whether there is more than just a small ankle sprain going on. The rules are quite simple. They are a set of guidelines for clinicians to help decide if a patient with foot or ankle pain should be offered X-rays to diagnose a possible bone fracture or something more serious. So the Ottawa Ankle Rules state that an ankle X-ray is only required if there is any pain in the malleolar zone and any one of the following: bone tenderness along the distal 6 centimeters of the posterior edge of the tibia or tip of the medial malleolus, or bone tenderness along the distal 6 centimeters of the posterior edge of the fibula or tip of the lateral malleolus, or an ability to weight bear both immediately and in the emergency department or in front of us for 4 steps without pain. Foot X-rays are only required if there is any pain in the midfoot zone and any one of the following: bone tenderness at the base of the 5th metatarsal for foot injuries, or bone tenderness at the navicular bone, or an inability to weight bear both immediately and in the emergency department or for 4 steps in front of you. Certain groups are excluded, in particular pregnant women and those with diminished ability to follow the test, for example due to a head injury or an intoxication. Several studies are strongly supportive of the Ottawa Ankle Rules in children over 6. However, the usefulness in younger children has yet to be thoroughly examined. If you go to a doctor or physio and they do not know these rules, please get a second opinion on yours or your child's ankle. Please download a copy of the Ottawa Ankle Rules if you are unsure. They're available on our website. I'll leave a link below. I want to make sure that you see the right medical professional straight away so your time isn't wasted. And yes, that does mean you may not even be referred to a physio, but we want the best outcome for our patients and the community. If you are unsure or you come to Ormo Physio and we believe you have a misdiagnosis from elsewhere, we will refer you on to get an X-ray or a specialist appointment before starting your treatment if we believe that is needed. Do like us on Facebook to hear about other offers and information on injury prevention. Until next time, I'm Sean Yates from Ormo Physio, and remember, exercise shouldn't hurt.